This is Counterpoint, and I'm Tanya Granick-Allen. As the dust continues to settle on COVID, many are still suffering the effects of the virus, the lockdowns, and in some cases, the vaccine. Once trumpeted as the best way to manage the spread of the virus, some politicians who impose lockdowns are now distancing themselves and perhaps attempting to rewrite history with some new facts. But what of the COVID vaccines? We are hearing a lot more of the concerns of not only their efficacy, but also their safety. As of March 2023, Canada's Health Info Base had recorded 54,569 COVID-19 vaccine adverse events, of which 10,685 were considered serious. InfoBase also reported 427 deaths following vaccination. According to Dr. Peter McCullough, a US-based world-renowned cardiologist, whom we've also had here on this program, he suggests that with a typical vaccine program, if there are even 15 or even 50 deaths, the program gets pulled. But the mRNA COVID vaccines were never pulled, despite the high number of reported deaths. So were these COVID measures actually helpful? What needs to be examined so we learn from our mistakes for the future? And why are there excess deaths amongst adults? Well, joining me now to share her research is Margret Kopala, writer, author, and public policy analyst based in Ottawa. Today, we're going to discuss her latest for the C2C Journal, The Virus, the Vaccine, the Victims, Beginning the Great Reckoning. Margret, thank you so much for joining me today. It's really great to have you on.
Pleasure, Tanya. Mine. Oh, mine.
So let's start right off the top. What prompted you to write this story?
I've been following the pandemic pretty closely for C2C Journal now since its inception, and one thing has led to another. We have the C2C has properly been giving full analysis to all the various aspects of the pandemic, and this was simply the next logical step. So we needed to do some kind of an update, get a check-in on how things were going, where we were. And when it emerged that all-cause mortality statistics now were soaring through the roof, it was clear that this was the issue that needed to be addressed in the latest article. So apropos, it so happened also that the National Citizens Inquiry, Canada's national NCI, was on its tour of Canada, getting input from various, getting input and giving voice to, quite frankly, giving voice to the many people who had suffered not only injuries but also injustices as a result of how the pandemic was managed, and high amongst the lists of problems were the injuries, not only the injustices to the unvaccinated, to people, for instance, who were being denied medical services because they were not vaccinated, but also the many people who had incurred all kinds of injuries and whose families had died or passed away under mysterious circumstances.
So and I was going to interrupt. So I know for your piece here, you throw out a lot of numbers, and obviously that's important because when we're looking to analyze data, we have to read the data. So where did you draw your data from? Where did you collect? Like, where did you get these statistics?
Okay, there were two. The first really interesting data emerged from a former hedge fund manager named Ed Dowd, who came out with a book called Died Suddenly. And in it, he took the perspective he used all the data from insurance claims prior to the big rollout of the vaccine, which took place when the mandates kicked in right back in 2021, late summer, early autumn of 2021. Prior to that, the death rate was sort of moving along. I mean, we knew that the most vulnerable were being affected by COVID, namely the elderly. But until then, other cohorts, other demographics were not that seriously affected. Mm-hmm. It wasn't until, but what happened in late 2021 was all of a sudden, all kinds of insurance claims, death claims were being posted for younger particularly young professionals.
Okay, I'm going to
And
pause
this
you
really
there.
alarmed Dowd. Yeah,
I'm going to pause you there because this is very interesting, and I want to make sure we dedicate the whole next segment to it. So we'll be right back in just a few moments. Stick around.